Health Minister Zweli Mkhize says strict precautionary measures will be taken over the Easter weekend to prevent potential coronavirus super spreader events. This statement comes as experts advised government to put the country under stricter lockdown level for the Easter weekend. They have warned that a third wave of coronavirus infections could hit South Africa after the holiday period. South Africa will mark 364 days since the country was placed under hard lockdown. Now, let's discuss this with Wits School of Governance, Social Security Systems Administrator Chair, Professor Alex van der Heever. Thank you so much for coming through and good afternoon.
Good afternoon, and to your listeners.
Well, firstly, the point of departure, should the country go into stricter lockdown levels as we are anticipating the Easter weekend?
I think it is a high-risk period, and it does merit consideration of a range of additional restrictions. I would not call it a full lockdown, but I do think that it would be appropriate to look at some precautions during this period. I think there's some evidence that the restrictions that were implemented on the 27th of December did impact positively on super spreading events and gatherings. And that was a less destructive set of restrictions than the level 5 restrictions originally introduced. So I think that we could look at a softer version of what was done on the 27th of December, just in case. That's despite the fact that we're not necessarily seeing signs of a third wave at this point.
So you're on since we went into stricter lockdown regulations and we had a disaster declared in the country so far. How do we gauge the country's performance, comprehensively looking at the way we started in how the lockdown was imposed? You remember there was a time when we had the first infections in the country. There was a debate on whether or not people should have been allowed to converge at different places where they're going to take their mode of transport to travel to different provinces. That would have been part of starting the spread throughout the country.
So there's a risk right at the beginning of an epidemic such as this when you try to minimize seeding communities. In other words, to prevent the virus from actually entering particular areas. I think we quite soon lost that battle. And once it becomes community-based, you've got community-based transmission in all areas, you're pretty much, there's no point really in blocking movement between areas. It becomes less effective as a measure. And it becomes far more important to manage super spreading risks. So moving somebody from one area to another isn't a super spreading risk. It's when one person infects 50 that you have a problem. And that's really the situation we're in now.
And another debate was the focus on one person who could have probably been infected and might have not known when he left Italy, but for them or for the plane to land in South Africa and the infection being attributed to one person in a plane that could have most probably had 220 passengers would have sounded a little bit naive to have 220 people get out of a plane with one person who was infected with COVID-19 not showing symptoms. Now, when these people travel to different areas of the country, why the argument of one infection of a person who eventually landed in Newcastle in KwaZulu-Natal?
Yeah, I think that, I don't think that we can be very certain about where the first people were that kind of seeded the epidemic in South Africa. It would be unclear. So obviously the big risk that was discovered with this particular virus is that people are asymptomatic when they're actually very infectious, and by the time they develop symptoms, they've already infected a lot of people. So the problem in February, March was that people were traveling through airports, on airplanes, and the risk management measures in place at those times were completely different to what they are now. So it would have taken a very small number of people traveling at that point to have caused a huge problem, even on the flight. So you would really not know where it went. From a notification perspective, we would have picked up somebody as the first person to be detected, but it's quite likely that wasn't the first person that was transmitting the infection in South Africa.
Yeah, I mean, like somebody would support that argument with the fact that once you get out of a plane, you move around at the airport, you probably go to the restroom, to the restaurant, to either catch an Uber, a bus, or family coming to fetch you. And when you arrive home, you still have people to greet, shake hands and hug and so forth. So the argument of one person could have really been short-sighted at that time. So that's one issue of the false start of dealing with the COVID-19 infection. So we'd say that perhaps that's an excuse because we didn't know better then. But right now, let's focus on the false starts regarding choosing a vaccine for the country and how the rollout happened as we are now actually inoculating only frontline workers.
Yeah, so it's very clear that the ball was dropped in 2020. It's quite clear that our core strategy and the world's core strategy going forward is going to be prevention through vaccination. We'll also have the sort of natural vaccination through infection, but unfortunately quite a lot of mortality comes with that. So vaccination is going to be our strategy, and it should have been an absolute priority during 2020 to not only try and acquire vaccine doses, even at risk, as well as prepare the ground game, as well as prepare for the rollout itself. And that all could have been done well before the end of 2020. But it was quite clear that nothing had really been done quite far into 2021. And some sort of knee-jerk movements occurred in January. But it's very clear that government was just not prepared. And we're facing the consequences of that now. The Johnson & Johnson vaccinations that are happening now are only part of an extended trial. So effectively to date, government hasn't vaccinated a single person as part of a scaled up rollout program. We're actually still awaiting an official government program.
Right, so now let's talk about the third wave. Is it imminent?
There's no real signs of it at this point. There are one or two provinces that look a bit worrying, but there's no kind of sign overall looking across all the indicators. So you can't say it's imminent. What we do know is that these various waves are definitely affected by human behavior. So as opposed to modeling a trajectory, it would have no purpose. We have to be able to understand how people are behaving. So our key contingent risk at this point will be the Easter weekend, when people will be socializing and may behave differently to the way they are now. So that's a period in which we might look at a very limited period of prevention measures in place to prevent a third wave from taking off. But I think we know very well now that we've got to manage super spreading risks. That has to be our focus. And if we do start to see a surge in infections occurring, then we should quite early on try and locate where those are and impose a number of limited restrictions. But it's very important that when these restrictions are introduced, that we do not destroy the economy at the same time. And I think that what's been shown is that we can actually introduce non-pharmaceutical interventions of various forms with minimal impact, not zero, but minimal impact on the economy. If we had done that right at the beginning, we would have been in a better position to support those businesses that might be affected by restrictions. But unfortunately, government is now in the position where it doesn't really have the capability to support many of the businesses that are harmed during any kind of combination of restrictions. It's their ability to do much is quite restricted. So at this point, we have to manage both the risk to the economy as well as the risk of a surge. So I think the experience of December 27 to about 12th, 13th of January has shown us we can do something along those lines. I still think we overreached in the restrictions in December, but it was also very effective in what it targeted, which was gatherings.
All right. Thank you so much for making time to speak to us.